Hi everyone, welcome to this video for our class on Friday tomorrow. And before I start our next system, which is the musculoskeletal system, I just want to remind everyone where we are right now as far as our course is concerned. So this is our week of 15th, 17th and 19th, Monday, Wednesday and Friday, which we were doing online totally. So on 15th and 17th, we have talked and completed the integumentary system. And today we were supposed to start the musculoskeletal system in person class. And I really want to be there in the class because these three classes which pertain to this particular system are too critical and important as far as kinesiology is concerned, because you guys are going to have a lot of terms in your coming up courses from this system, and I personally want to go over it slowly, want to repeat a lot of terms, and just want to recapitulate things as much as possible, which is sometimes difficult to do if you are recording a video. But I'll just try my best to discuss a lot of osteology today. That's our primary aim for today's class. And then next week, hopefully, once we meet in person, then I just want to revise this one a bit to make sure that everyone is on the same page. And then we can go ahead and discuss on Monday and Wednesday in a lot of detail about a lot of terms from this system. So let's make a start and see how it goes. So for musculoskeletal system, these are our four broad objectives. We are basically looking for naming the structures which constitutes this musculoskeletal system. It's basically a combination of a couple of systems: the muscular system, which is about the muscles, and the skeletal system, which is about the bones. So our main focus today is on the skeletal part, and we try to discuss a lot of bones, their terminologies, and try to decipher things which are related to these bones. A lot of emphasis is there on pronouncing the words in their right way, how to spell them, and to some extent how to build them in order to, the words which are related to this musculoskeletal system. And in our next classes coming up next week, then we will dive into the pathology, some of the procedures, and at the end, one slide about some of the drugs which pertain to this musculoskeletal system. So let's start with some very easy and basic terms before we move on to some intricate stuff. So the first one word which we are going to talk about is articulation. So let me try to get our zoom feature going. So this articulation is about joints or combining two bones maybe. So if you see this particular diagram, which will show us about articulation, ligaments and tendon, this articulation technically means that we are joining this femur in the thigh and these two bones, which are the tibia and the fibula in the leg. So we are joining things. So this is a sort of articulation. Now, if we talk about ligament, this is a ligament. And the basic difference between a ligament and the word which is coming up, tendon, is that a ligament is going to join two bones. So this is the first bone, which is the kneecap or the patella. And this is another bone. This is the second bone, which is the tibia. So this particular fibrous tissue or ligament is joining these bones. On the contrary, if you see a tendon, it is joining a muscle with a bone. So here you have the muscle coming up, and this quadriceps muscle is joined with the help of this tendon with this bone. So if there is a connection between Two bones, that's a ligament. If it's a connection between a muscle and a bone, that's a tendon. All right, we can go over this slide pretty quickly because we have talked about these three types of muscles. The first one are the cardiac muscles, which are present in the heart. The second one is the skeletal muscle, which are, of course, present in the skeletal system of all these bones. And the third one is the smooth muscle, and I've talked that GIT or gastrointestinal system, which contains the stomach, liver, intestine, are the most, everywhere inside the GIT you will find smooth muscles. So these are three big and fundamental types of muscles. Now, here comes our main focus for today's class, the osteology. So let's try to decipher this term. Osteo, we have already talked, it means bones, and logy is about study. So if we are studying bones, that's osteology. And we are going to go over many of the bones in the next maybe 35 minutes really briefly, because this is not an anatomy class where we will go into a lot of details about the bones. The main idea is that you will have a wide understanding, a basic understanding of a lot of terms which are related to bones, both from the head, face, and the skeleton. So let's start from a very basic diagram. This is a skeleton, and you can see that it's divided into two colors, and and the axial skeleton is the one which is shown in tan color. So the skull along with these ribs and all the vertebra, this constitutes the axial skeleton because that provides the access to the body. And the second part is the appendicular skeleton. And if you remember our previous lectures, we have talked about the term appendages, which are the structures related to skin. Here, these are the structures, the upper limb bones, and the lower limb bones are the surrounding or the supporting structures to this axial skeleton, and that's why the one which is shown in blue is the appendicular or the supporting skeleton. Now these are a couple of functions which the skeleton serves. The first one is to provide support, and it protects the body. So protection and support, one of the functions. All these bones have huge amount of calcium, and this calcium is sufficient to provide the homeostasis of calcium in the body, because calcium is required for a large number of physiological processes, and it's maintained between a very narrow range of 9 milligrams per deciliter in our blood. So that range is maintained through a variety of hormones, but the storage of calcium, the big storage part, is there in our bones. It produces blood cells. So if you have remembered, we have talked about the RBCs, the WBCs, the platelets in our previous classes, the erythrocytes, the red blood cells, the leukocytes, the white blood cells. So they are produced inside these bones in bone marrow. So these are a couple of functions and the basic difference between the axial skeleton and the appendicular skeleton. Now, bones are of four types. These are the short bones. So if you see our hand, these bones, which are specifically the carpal bones, these are the short bones without any specific shape. You can see all these bones 1, 2, 3, 4, 5, 6, 7, 8. They have no specific shape. So these are some short bones in the hand, and there are bones in our feet as well, which are the tarsi. Then have these irregular bones, and I'm pretty sure that from your exam you are aware that these are the 7 cervical vertebra, then you have the 12 thoracic, then 5 lumbar and 5 sacral, followed by this coccyx. So these vertebra have some irregular sort of shape. There are some differences even between the vertebra depending upon their specific functions. So vertebra are examples of irregular bones. Now the third one are flat bones, and the commonest ones are the skull bones. So all the bones in the skull, all these frontal, parietal, occipital bones, they are just flat in shape. So these are the flat bones. And the last one are the most typical bones which form the appendicular skeleton, which are the upper limb bones, the humerus, the radius, the ulna in our upper limb, and the femur, the tibia and fibula in our lower limb. So these are typical examples of long bones. And they are divided into diaphysis, which is the long part of the bone, and it has a couple of white ends on both the sides, the proximal and the distal one, and these are the epiphysis. So epiphysis and diaphysis are the two broad of a long bone. So we have four types of bones: short bones, example hands; irregular bones, example vertebra; flat bones, example is skull; long bones, all the limb bones. Now let's go on and see and talk about long bones in a bit of a detail. Now this is a typical long bone, and this bone, yeah, you have guessed it right, that's a femur, and we will talk about some of the parts pretty slowly. We'll start with the diaphysis, and I think I've just talked, this is the long part of the bone from here to here, and then you have a couple of ends of the bone which are the epiphysis, and if it's away from the body, that's distal; if it's towards the body, that's proximal. So keeping in mind their particular anatomical location, they are said to be either proximal or distal epiphysis. Now let's see what's inside these bones. So you have a spongy bone which has this red marrow on the side of epiphysis, and this red marrow is the site where the RBCs and all the hemopoiesis, or the formation of red blood cells, takes place. And that is a spongy part of the bone, which means that it is soft and it has spaces in between. So if you take a cross section, so you will have these spaces, 1, 2, 3, in between the dense bone structure. So that's a spongy bone. And if you compare and contrast it with a diaphysis, if you take a cross section here, this is just compact. It won't have any spaces in between. So it's a part where the bone is really dense in structure. If you look at this medullary cavity, this is only present in the diaphysis. So this is a cavity which is present in the diaphysis, and it contains the yellow marrow. So please make sure that epiphysis has red marrow, as you can see here, and diaphysis has, this part has yellow marrow. And the covering which is around the bone, so you remember peri is round, ostium is bone, so the outermost covering around the bone is the periosteum. So these are some of the basic parts of a long bone. If you just quickly revise it: whole bone divided into this long part, diaphysis; ends, epiphysis, the proximal and the distal one; and then you have the spongy bone which has red marrow in the region of epiphysis, and the yellow marrow in the region of diaphysis inside the medullary cavity, where the bone is more compact and it's surrounded by a layer which is the periosteum. All right, let's move on and talk about some of the surface features of the bones. And this is a bit complex for sure. I'll try to use some of the pictures to make it clear. Let's hope that it's easy to go through. Now, there are some projections on the bones, and these can be non-articulating surfaces, which means that there are projections, but they are not meant for forming joints. Because if you remember the word articulation at the beginning, it is a term that refers to joint formation. So there are surfaces which are not meant for joint formation. And for example, these trochanter, and I have a diagram of femur again, and this is the one which I'm just trying to highlight. So the one which is on this side, which is more prominent, is the greater trochanter. So it's a projection, you can see it's protruding out, and this is a smaller protrusion, that is why it's the lesser trochanter, but it's not meant for joining, for formation of joints. Then you have sites of muscle and ligament attachment, and that's where the tubercle and the tuberosity comes into play. So one of the better examples of tuberosity is not present in this bone. It's there in humerus, where you have a greater tuberosity and a lesser tuberosity, just like the greater and the lesser one, but this is present in humerus. So these are the projections which are meant for attachment of either the muscles or the ligaments. And then you have the articulating surfaces. Now this is important because they are going to form joints, and it's written that they are the projection that form joints. And I've used the same diagram because we have condyle, this lateral condyle of femur, and the medial condyle. So depending upon its location to the medial axis, it is divided into lateral if it's away, and if it towards, it's the medial one. So this is going to form a joint with the tibia down. So because it's forming a joint, so these projections or surfaces, not projections, the surfaces are the articulating surfaces. And if you look at this head, we can look at the head of femur, which forms a joint again with the hip bone. Sorry. So if you just recapitulate our discussion so far, we have projections and articulating surfaces. Some of the projections are non-articulating, for example, this trochanter, the greater one and the lesser one. Some of them are the sites of muscle and ligament attachment, for example, the tuberosity, the greater tuberosity and the lesser tuberosity of, it's not written well, I'll just try to write it slowly, the humerus. Okay, this is in the upper limb here, this bone of the arm bone. And then you have the articulating surfaces which form joints. And a great example is condyle, the medial condyle and the lateral condyle. And both these condyles of femur are forming joint with tibia, this bone. And you also have the head of femur forming a joint with the hip bone. Now we have depressions and openings, and these are mostly meant for the skull bones. So if we talk about this meatus first, so meatus is, let's zoom it, let's see how it works. So meatus is this canal. It's an opening. For example, this is the opening of our external acoustic meatus, which starts from here and it goes up till this tympanic membrane, which is the eardrum. So it's a sort of passage which connects the outer world to the inner part of our different body structures. So that's a meatus, a really common example. Then you have the foramen. Basically, foramen are different holes or passages. Let's zoom it again. So you can see these foramina. You can see this one inside the orbit. You can see this particular foramen here. There is a foramen here, and these are the structures through which nerves, vessels, and arteries they just pass through. So it's a kind of a passage, a very small passage through which different structures pass. And there are some big foramens inside the skull as well. For example, if you talk about foramen ovale, that's a very big foramen inside, the most famous one, through which a lot of structures they just pass through. So please make sure that foramen are holes or openings through which structures get or pass through. Then you have a word which is fissure. Now, fissure can have a couple of meanings. If you look at the meaning of the fissure in terms of bones, you can see this infraorbital fissure or the prominence of this orbit. Let's zoom it again. So you can see that this is a fissure which is a sort of crack here. You can see this dark structure. So it's possible that it's present in the orbit. It's also present as a very common disease, which is the anal fissure, which is a really common surgical problem when the anal canal just gets cracked. So it's basically a cracking of anal canal, which is the anal fissure. So it can have a couple of meanings. You can have supraorbital fissure, you can have infraorbital fissure in the orbit or in the face, and it can be surgically meant for the anal fissure. Then you have sinuses. Sinuses are sacs or maybe spaces which are filled with air. So air-filled hollow spaces are commonly known as sinuses. And you can see them here. I think let's okay, just a quick way to discuss this. Yeah. Now, you can see these sinuses. So these are the frontal sinuses, which are the fluid, the air or hollow sac behind this frontal bone. So if you have inflammation of these sinuses, you have a very common disease that is sinusitis. So if you have inflammation of these sinuses, that's sinusitis. And if it's there in this region, that might be a maxillary sinuses. So depending upon their location as per the bone, they are named as the frontal sinus or maxillary sinus or ethmoidal sinus and so forth. But the important thing to remember here is that these are hollow air-filled spaces behind the bones. Now, this is again a big slide with some long discussion of around 10 minutes because I'm going to talk about bones quite a lot in this structure. So let's start here. And the way I'm planning to discuss this whole skeleton is to take it, region wise. So we'll first talk about the head and neck, and I won't discuss it much here because we have a couple of slides to discuss it in a lot more detail. So this part is the cranial cavity, and you have these two big holes. These are the orbits for the eye and its appendicular structures, and then you have this big area or bone which is just beneath the frontal bone, the maxilla, and then you have the mandible, which is the only kinetic bone, the jawbone of our face, and then you have these vertebrae which are present in the region of neck, the cervical one, and this is the skull, which I'll just talk in our next slide. We will then move and discuss this area, which is the ribs. So these are 12 pair of ribs. So there are some ribs which are attached to this part, which is the sternum. So these are the ribs, all these 12 pairs on both the sides, and these are attached to this central bone, which is the sternum. Of course, the sternum has two parts. You can see the top part, which is, it's not written, but this is the manubrium, manubrium. So that's the part which is the manubrium sternum, and the part which is down is the body of sternum, and the small part at the end is the xiphi sternum. Anyways, then you have this collarbone, which is the clavicle, the bone which is present here, this prominent bone which is pretty near to the skin. This is clavicle, and this is one of the bone which lies horizontal in our body. So that's interesting trivia. And then you have this bone at the back, this triangular bone, that is the scapula, which is sometimes refers to as our shoulder blade. So if you go back and feel, then this bone which is there on our back and forms the shoulder girdle is the scapula. And these two bones in combination, the clavicle and the scapula, are sometimes referred as the pectoral girdle. Let's move on to this upper limb, this area. We have humerus in our arm. We have radius and ulna. The one which is medial is ulna, which is towards this side. And the one which is lateral is the radius. And then you have the parts which constitutes our hand. And this is divided into carpals, the 8 bones which just don't have any shape. So we have 1, 2, 3, 4, 5, 6, 7, 8 carpals. And then you have the long bones, some small 5 long bones, which are metacarpals. And the word meta, if you remembered our discussion from our first chapter, it means that it is present after. So because they are present after the carpals, they are the metacarpals. And then we have these digits. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So these are the phalanges. So we have the carpals here, 8 carpals. Then we have the 5 metacarpals, and these digits of our hands are the phalanges. Okay, before moving on to this hip bone, let's discuss the lower limb now. Just like the upper limb, we have the humerus here. In this case, we have this long bone, which is the femur. And then we have a couple of more bones. The small one, the very thin one, is the fibula. And the one which is the bigger one, which actually articulates with femur technically, is the tibia. So the bigger one is tibia, and the thin, small, long bone is the fibula. And there is an additional bone, which is the kneecap, is the patella. So please make sure we have femur in the leg, we have femur in the thigh, the tibia and fibula in the leg, and we have a joining patella at the level of knee, and that's the kneecap. Now, if you look at the foot, these three bones constitutes our foot. And just like carpals, we have the C replaced with T. So now we have a lot of tarsal bones. And please make a point here that I'm not giving you the names of the carpals and the tarsals, because I just don't want to make this discussion more complicated. You just remember that these are some of the irregular bones. If they are present in the hand, they are the carpals. If they are present in the foot, these are the tarsal bones. And similarly, like metacarpals, you have the metatarsals because they are present after the tarsal bones. And similarly, like hand, where we have phalanges, we have similar name, the phalanges of the foot. So all this great toe and the little toe, the small structure, the shapes might vary, but essentially these are the phalanges of our foot. The last part which I'm going to discuss, and I want to use this diagram, is the hip bone. So if we talk about hip bone, this part, or the part which is shown in brown, is the ilium. And why I have used this diagram along with this one, because it won't specify the three basic components of a hip bone. So I always want everybody to understand that if we talk about hip bone, we have a big part that is the ilium, and then we have a part which is the pubis, which is this part which forms the symphysis pubis, and then we have this ischium, which is this part with this particular opening. So ilium, ischium, and pubis are the three parts of the hip bone. And ilium, pubis, and ischium, this is the hip bone, and this sacrum and coccyx are the parts of the vertebra which is coming from the axial skeleton. So all these five combines to form the pelvic girdle, and this part where these two pubis bones join with each other, they forms this symphysis pubis. I completely understand that there are so many bones which we have talked, because essentially we have talked about at least some of the basic bones of our whole skeleton. So I thought that I just try to stratify them depending upon their region, and I will go over them once more again very slowly to make sure that everybody understands it. Let's discard this slide so that we don't have all these red marks here, and revise with a fresh screen. So we have started discussing the head region, where we have the skull, the maxilla, and the mandible, which is our jawbone. Then we talked about this vertebra, which is the 12 cervical, then we have the 12 thoracic, then the lumbar, and the sacrum. Then we talked about the sternum, which has the manubrium sternum, the body, and the xiphisternum. And attached to the sternum, we have all these 12 pair of ribs. Then we have a couple of bones here, the collarbone or the clavicle, and the shoulder triangle bone or the scapula, which combines to form the pelvic girdle. Then we talked about the upper limb, where we have this big bone in the arm as humerus, and a couple of bones in the forearm as radius and ulna. And then we have these 8 carpals in the hand, which are followed by these metacarpals and these digit bones as phalanges. So this is all about hand. Then we move to the lower limb, where you have the long bone in the thigh as femur, a couple of bones here as tibia and fibula in the leg, and then you have similar irregular bones in the foot, the tarsals, followed by metatarsals, and the digits forms the phalanges. And then at the end we have this pelvic girdle in total, which is formed by the hip bone, which is the ilium, the ischium, this part, and the pubis, the medial part, and the sacrum and the coccyx are the parts of vertebra. So all this part from the vertebra and the hip bone combines to form the pelvic girdle. So I hope after a couple of revisions over all these bones, it's a bit easy to follow. And if you still have questions, just feel free to ask me in the class or email me. All right, let's move on and talk about the cranium specifically. So this is our cranium, and we have a few bones here. So the bone which is there in the front is the frontal bone because it faces anteriorly. And then we have a couple of bones, one on this side and a similar one on the other side, which are the parietal bones. And then you have the small bone at the back of our head, that's the occipital bone. And there is a bone where you can see this occipital, the parietal, as well as the frontal are going to join. There is a joint which is known as the temple, and the bone which is near or pertaining to temple is the temporal bone, or the bone which is present here. So we have our frontal bone in the front, we have our two bones on each side, the lateral parietal ones, and then we have the occipital bone at the back of our head. There are a couple of more names. There is a suture, you can see this joint. So this suture is the squamosal suture, a bit uncommon, and this is very common, the coronal suture, which joins the frontal with the two occipital bones on both the sides. So you have a frontal bone right from here up to here, and there is a parietal bone here and the similar parietal bone on the other side, and the suture just runs from here, goes on the other side, and it goes on the other side and join these bones. A couple of bones here, the ethmoidal and the sphenoidal one, which we will discuss once we discuss about our sinuses. So just recapitulating this slide, we have the frontal bone in the front, couple of parietal bones on the sides, and the occipital bone at the back, and then we have this common temple area which joins frontal, parietal, and occipital, and the bone which is which covers the temple is the temporal bone. And I presumably feel that this is our last slide for today, but we'll discuss about some of the facial bones. So we have a couple of bones which forms the nose, so these are nasal bones, and then we have this maxilla. So this is somewhat forms the maxillary area or the maxilla. And then we have this jawbone, which is the mandible. So this is the TMJ or the temporal mandibular joint. Once we are speaking or eating, then we have a movement at this joint. And this is the only bone which shows motion. So this is a kinetic bone. And there is a very small bone here, which is the partition between these two nasal cavities. So this is vomer. And then you have this zygomatic bone, which is the cheekbone. So all our movements, for example, gestures such as smile, so all these muscles are attached to this zygomatic bone. So this is a cheekbone. And this bone somewhere here is the lacrimal bone. And it is said to be lacrimal because it has the lacrimal gland pretty close to it, which forms all the tears in our eyes. So this is a lacrimal bone. So just recapitulating things, the one which is around the nose is the nasal one, the cheekbones, the zygomatic one. The bone inside the eyes or somewhere here, these are the lacrimal ones. Then you have a vomer which divides these two nasal cavities. Then we have this bone which is the maxilla, and the bone which is the jawbone is the mandible. And this is our last slide for discussion today. So these are the sinuses which I have taught, which are the the air-filled sacs or hollow spaces behind these bones. So if you have sinuses here, these are the frontal sinuses. If you have sinuses on the ethmoidal bone, behind the ethmoidal bone, these are the ethmoidal one. If we have sinuses in the region of maxilla, here, these are maxillary sinuses, and we can have ethmoidal sinuses near behind the ethmoid bone. So these are air-filled sacs, which are known as sinuses. So guys, I hope that this huge discussion about a lot of facial bones, the cranial bones, the arm bones, the forearm bones, the rib, the chest, all the sternum, the pelvic girdle, which includes the hip bone, and the sacrum and the coccyx, and the lower limb bones, along with the hand and feet. You might find some of the stuff easy, some of the things are complex and intricate. I suggest you to go over this PowerPoint a few times, and we will revise it again very briefly, of course, in our class on Monday, and then we'll go ahead from here. If you have any questions during the weekend, just feel free to email me. But I really respiratory system and the you have to make a start for the musculoskeletal system. So please make sure that you go over these videos again, because after this week, we have a couple of weeks before we have our second exam due in the second week of March. So please make sure that you are right on the track for exam 2. If you have any questions, feel free to email. Thank you very much for your time for watching this video.